Afternoon. This is Lee Bewley. I'm the program director of our MSHA program. It is noon. Our information session is scheduled to start at noon. I'll give folks 1 minute before I begin the formal presentation of our information session, share a slide set that addresses a lot of the questions and perspectives we have of potential applicants to our MSHA program or some of our certificate programs. We are recording this session, so if folks had RSVP'd to attend and they were unable to attend this live session, they can go back and review the content that we had in the presentation. And then we want to be sure to give everyone a chance that attends this session for any questions that you may have about either the application process, what is the experience in the program, and then, what are things that you should expect after graduating from the program. So without further ado, I want to welcome you all. I'm going to share the slide set and cover the information components of our MSHA program and our associated graduate certificates. And then I'll open up the session for questions. We should take about 25 or 30 minutes total, including a Q&A session. All right. Welcome. Again, I am Lee Bewley. I am a native Kentuckian, retired from the Army Medical Department and returned home to join the faculty of the University of Louisville. My time in the military, I was a combat health support officer, and then I was a health administrator. And at the end of my career, I became a faculty member and a program director and associate dean for programs to develop military and federal healthcare leaders through an affiliated program with Baylor University. I joined the faculty of the University of Louisville in 2016. We've developed a couple of programs, including our own Master's in Science and Health Administration program. I am also the regent for the Kentucky chapter of the American College of Healthcare Executives. American College Healthcare Executives, a professional organization dedicated to advancing the development of healthcare leaders across healthcare industry, but specifically hospital, health services, group practice, and health systems. We provide this connection to our program to ensure that our content and our curriculum is current, that we develop students in a way that will be effective in work requirements, but also to provide a basis for networking, development within the program. There are often resources that are available through Kentucky ACHE, through continuing education development, networking, professional development sessions, and opportunities to attend some of the national symposiums and conferences. We just took a group of 9 students to the American College of Healthcare Executives Annual Congress in Chicago. And then, of course, anything that we can do to provide connections with students, provide and enhance the experience, even to alumni status. So why healthcare management, health administration in general? Look, we have a compelling case that, given that nearly 1/5 of our economy is dedicated to healthcare, and when you consider the outcomes of our health, which in many cases are extraordinary in terms of clinical interventions and the ability to save lives, develop novel solutions, medications, drugs. We have a pretty remarkable healthcare economy, but in terms of outcomes, we lag some of our peer competitors, other countries. And we also, in our country, we don't have a full access to healthcare across all of our citizens. And so the role of management and any type of organization is to be able to effectively and efficiently utilize the resources that are allocated. And so as a healthcare executive, a health administrator, healthcare management professional, we develop competencies that are intended to take the resources that are available within your organization, within your health system, and to use them to their most efficient and effective perspective. And so to do that, you will be able to either meet your organizational goals, whether or not it's profit, market share, community served, or to be able to ensure that, of course, you meet the requirements of your role to move and advance in your career. In terms of your career, we see that the median income for a healthcare manager in the United States is currently $118,000. That's not to say that immediately after graduating from our program, you'll earn $118,000 or more, but over the course of a career, in current context, the average median salary is $118,000, and the growth rate of healthcare professionals that work in health management is growing at 29%. Both that rate of median pay and the growth of those manager positions far exceed most career fields. And so it's to this point that we're trying to find more effective and efficient utilization of resources to serve people, serve beneficiaries, serve communities. Look, the future of healthcare management, you need to take a population health management perspective. One part of that is born of the pandemic in terms of that we're all in this together. But the other part is the way that healthcare costs are going to be controlled, or the actions that we take in order to coordinate care in a community or a group perspective. Yes, each patient choices, each patient intervention is critical to maintaining quality care, but the way that we organize the resources will take more of a market or a population perspective. We need to be able to understand new financial models, the older legacy models that in many cases are still in place, fee for service, where patients simply come in for care, or they buy a product, they receive a service, and there's compensation or reimbursement provided, still holds into a great degree. But we're moving away from a case where we have allocation of resources, a bucket of money, capitated, or some type of shared pool of resources between providers and payers, that may even include the patients in terms of those choices and decisions and incentives to be able to have higher levels of health. And so we need to be able to shape and understand and then shape those financial models to achieve those effects. We're going to leverage information systems. We're going to leverage technology. We're going to leverage artificial intelligence. And you will learn those concepts and principles in our program. And then the bottom line is we are in the people business. We are aiming to serve people, to be able to lead within our organizations, peers, colleagues, and to be a leader in our community to manage that population health. So there are three things that leaders can expect when they attempt to, influence or to take a group of people, individually or collectively, to a better or different place. They can either expect resistance, compliance, or commitment. Those leaders that are competent and are able to make the case and of the way forward are more likely to avoid resistance, and at least earn compliance. But what we're having is the most competent leaders are able to achieve commitment, towards those goals and objectives of the organization, and to get outcomes that are efficient and effective and that meet the organizational goals. These are all the places. Like, where can you work? Everywhere you see healthcare organization or healthcare adjacent, hospitals, health systems, group practice, federal, state level, entrepreneur, logistics, we have healthcare managers, health administrators working. The different roles can be at the operational management coordinator, analyst level. It can be a vice president, director, and then working your way up to CEO, president, or a partner or owner of a healthcare organization. My slides are there. Why Louisville and why our community? Look, our University of Louisville, our MSHA program, is centered right in the middle of a nexus of regional healthcare. We have major health systems, including the University of Louisville Health System, one of the newest academic health systems in the country, Norton, Baptist, major corporate headquarters for healthcare and long-term care, managed care health insurance. But we also have a bunch of entrepreneurs and folks that are looking at medical technologies and ways to advance the way that we enhance care. We leverage the local employers, the local health systems for a lot of our case studies and content. Of course, a number of our grads work here, or they come to Kentucky to work. And then so we have some faculty that come from these organizations, or they have experience working in these organizations before they transition to academics. Our graduates are all across the country. We continue to update this slide set. We have folks that work in the federal government, Army, Navy, Air Force, Coast Guard, the VA, some of the major health systems in our region. Each year, we have students that are selected for administrative fellowships and then move on in their careers. The bottom line for our program is that you're going to have courses, you're going to have content that will develop you to be a health administrator, but ultimately we're aiming to build leaders that model and serve as exemplary ideals of honor, integrity, and professionalism. We also believe that if you're going to take a position of authority or responsibility serving people, you should be competent. And those competencies are developed within each one of our courses, and they're evaluated with feedback. Look, a little bit of a celebration. Our program is accredited by the Commission on Accreditation of Healthcare Management Education. Our School of Public Health and Information Sciences is accredited by CEF. And among those 164 programs that are accredited, you'll see very soon there will be an announcement that our program is ranked number 39 or a top quartile program in the United States for healthcare management education. Look, the way that we see our rankings is that it's aspirational. We want to have a quality program, which we are in terms of being CEF accredited and CAHME accredited. And we have colleagues that are doing well. And we think that our students, our alumni, are our prime credentials. And so we're always looking to advocate our students and our alumni out in the field to make that reflection, and continue to move up in the rankings. But, we are very well represented with accreditation and our standing among peer programs across the country. How do we develop our students? Our online MSHA program consists of 43 credit hours. A student can be full-time or part-time, over a 5 or 6 year period, they can work on the degree, or a student could matriculate in fall of a particular year and then graduate in the next fall. And so a little over 15 or 16 months could be in a graduate or somewhere in between. We say that students have the ability to tap on the brakes or mash on the gas, in terms of whether or not they take 1 or 2 or 3, or potentially in a particular 8-week semester, if there were a lot of things going on in your workplace or in a personal, professional perspective, you could even have no courses for a particular period of time. The schedule of courses we have are predicated on that our students matriculate into the program in the fall. And so you see 8-week courses, fall 1, fall 2, spring 1, spring 2, and then summer 8 weeks. In each of those 8-week periods, we have 3 courses that we typically offer on a regular schedule. In fall 2, we also offer the PHMS 690 MSHA capstone course. And as I briefly noted there for a second, a student could matriculate, for instance, in fall of 2026, and by taking a series of courses and one part overload with approval from the graduate school, a student may take extra courses, to take the full 3 in a particular 8-week term in spring 1 and spring 2. You could start in the fall of 2026 and then graduate in the fall of 2027. And so along the way, again, students can take a combination of 0 or 1 or 2 or 3 courses each of the 8-week terms. So that is our MSHA program. I would note that our program is opening the option that for students that have less than 1 year of organizational experience in healthcare, they can be admitted into the program. And that beginning in the fall of 2026, those students that come to the program with no prior or less than 1 year of organizational experience, they can still be admitted into the program, but that they would have a required practicum, which requires 3 credit hours, which is another way of saying that if any student that has more than a year of healthcare organizational experience is not required to have a practicum. All right. I showed you our MSHA program, the fall 1, fall 2, spring 1, spring 2, and summer. And I should note that there are breaks between fall 2 and spring 1. So our fall 2 courses usually end the first week of December. And so after the first week of December through about the second week of January, students have a break during the traditional holiday period. Between spring 2 and summer, our courses in spring 2 generally end the first week of May. And so for the rest of May, students have the second, third, and fourth week of May, there is a period of break. And then the summer session is basically the months of June and July. And then that first 3 weeks of August after the spring, the summer term is over, then students have a break before classes resume, usually the third week of August. Okay, we have 3 healthcare certificates. There's a healthcare management certificate, a healthcare financial management certificate, and a healthcare quality and project management certificate. Each of these certificate programs consist of 12 hours. If a prospective student was interested in first starting a certificate program rather than the MSHA program, they could apply for the certificate program, complete that particular certificate, and receive a graduate certificate that it looks exactly like a diploma. It just focuses on a specific area, healthcare management, healthcare financial management, or healthcare quality and project management. Student could complete that certificate and then For all those courses that they earned an A or a B in the healthcare management certificate, they could apply to the MSHA program and then transition and transfer all of those credits towards the MSHA. Extended point, if a student wants to simply go straight to the MSHA, there's no need to complete any of the certificates, but we provide a choice that for perhaps there's a student that's interested, in a specific aspect of our curriculum. They're taking a job as a budget officer, or they're new to healthcare, and their employer will provide enough money, for instance, in tuition to cover a certificate, then you might want to take a healthcare management certificate, complete that certificate, get a sense of the curriculum and the content, and then transition over to the degree program. So happy to answer any questions in the Q&A session, but we give choices. There's the full MSHA program, 43 credit hours on an online basis. And then there's select courses within our curriculum that contribute to one of those three certificate programs. All right, some program highlights, and then we'll get to Q&A session. We are very strongly tied to the professional organization, American College of Healthcare Executives. It's the largest healthcare leader, healthcare executive program in the country. All of the states have their own state chapter. Some of the larger states, like for instance, Illinois, there's a Chicago chapter and then a chapter for the rest of the state. But our Kentucky chapter provides a great deal of resources, networking opportunities. We hold events in Lexington, Frankfort, Louisville, even in Western Kentucky, and we're in Pikeville earlier in the year. And so across the Kentucky, there are continuing education and professional development or networking opportunities. Each year, there's an annual Congress. This year, there were 7,000 healthcare leaders, ranging from senior executives, CEOs, to graduate and undergraduate students that attended the Congress in Houston, Texas. Next year, that ACHE Congress is going to be held in Nashville, Tennessee. Each year, we take a group of students that they receive travel stipends from the program. Kentucky ACHE similarly provides some contributions. It's hundreds of dollars that help defray the expenses. And National ACHE, for students that are enrolled in CAHME accredited, higher education network programs such as ours, the National ACHE provides opportunities for students to have 2 or 3 hours of volunteer service at the National Congress, usually in the form of being the individuals that welcome people into each one of the sessions, or they help at registration for 2 or 3 hours. But the thing is that you can have your registration fees covered through service as a student. And so great opportunities. We're very active in case study competitions and graduate essay competitions for those students. That it's like an extracurricular activity. On a practical level, if a student participates in a case study competition or attends or enters one of the essay competitions and comes for the award ceremony, it's an opportunity to have an accolade, something that you can add to your resume or CV. And any scholarship money you win in the case study competitions or the essay competitions is your own to fund your education. Also, in the case study competitions particularly, you get a chance to test out and get feedback directly from practicing healthcare executives on the work that you're doing. Any expenses associated with a case study competition, for instance, when we travel to Birmingham, Alabama for University of Alabama, Birmingham, or Ohio State University, or the National Association for Healthcare Executives annual case study competition, the program covers the cost of registration and travel for a student to attend these competitions. It's a networking opportunity as well. Also, from a program perspective, we want to see how you perform. And so there are small groups. It's on a volunteer basis, and we can get into it more when you're in the program, or if you're interested, if that's something that's interesting to you. Because we're a CAHME accredited program, there are a number of competitive administrative fellowships across the whole country and our region that students apply for in a postgraduate perspective. As soon as you graduate, you can transition directly to one of these fellowships. It's usually 1 or 2 years. It's a full-time job. It's good pay. And it provides a jumping off point, a booster towards becoming a healthcare executive. The hospitals and health systems that sponsor administrative fellowships generally have a very good idea of how post-fellowship, how they want these people to join the team, usually as a director or as a senior manager within their organizations. And this summer, one of our graduates, Sydney Durbin, will start off as an administrative fellow at the University of Kentucky healthcare system. Look, our faculty are all doctorally educated. We have a couple of practicing managers that work project management, and we have a number of former healthcare executives that are board certified by the American College of Healthcare Executives. So a great group of faculty that have practical experience, doctoral education. We have 2 executives and residents. One is a physician executive, former chief medical officer of one of the major health systems here in the Louisville area, and another was the director of population health management for Kentucky One. We are CAHME accredited and very strongly tied to the Association of University Programs of Health Administration. Again, 8-week terms. We tailored these courses in 8 weeks for working professionals to be able to focus on a single course or 2 or 3, rather than having a traditional semester of August through December, January through May. We have what looks like about a 2-month period, 8 weeks, that you can focus on a class and then move on to the next class. As a working professional, we find that the pace of progress and the ability and the academic focus that it provides has been very successful for our students. And so we are in the process of developing. We're always developing and making sure that our content is good, but with specific emphasis to ensure that advanced analytics and artificial intelligence are embedded as a core component of the way that we incorporate tools, decision-making, and analysis for our students in the program. All right, some kudos. I told you that our students, in some cases, are our best credentials and our alumni. Look, we've done well. I mentioned those case study competitions and essay contests. One of our students was the national winner of the American College of Healthcare Executives annual STOL contest, the essay contest, the SACS, the accreditation body. There's a scholarship for entrepreneurship in healthcare, and in our case study competitions, our students do really well. We compete each year. There's some really great competition out there, and even though we might not be finalists or semifinalists in some cases, the participation and showing up is great for the program, which contributes to those rankings. It also provides a basis for our students to develop a network of among peers that are the contestants from other schools and programs, and to interact with healthcare executives across the country. And then that bottom line, the administrative fellowships, that's just a few of the examples. The Medical University of South Carolina, Cincinnati Children's, Sutter Health, out in California, the Army Medical Department, Baptist, Norton, Kansas City Children, Atria, UK Health. We're continuing to add to the list, and we're very proud of our students that go out there into the transition as alumni. All right, I'm going to close this out. I'm Lee Bewley. I'm the program director. Our director of student recruitment is Ms. Deepti Jain, and on the call with us today is our program coordinator, Brian Mathis. If you have any questions, you can contact us. That inquiry form, you can use your phone, your smartphone, or scan it to send information. July 1st is the deadline, and I'll say we aim to have all of the decisions, by that first week of July. In the event that a candidate or an applicant, had most of their application in before July 1st, and they need like one last letter of recommendation or something, that's fine. We continuously review applications, and look, we don't batch them. As soon as the application packet is completed, then we schedule an interview, and that interview is virtual on Microsoft Teams. And the interview is all about fit. We want to make sure that what you're looking for in your graduate healthcare management experience is matching what we're offering. And then, of course, we want you to be able to ask some questions to make sure that what we're offering is a match for you. So what are the things that are in the packet? We're looking for your transcripts from that contributed toward your degree, whether or not it's a bachelor's or a bachelor's and a master's or even a doctorate for some folks. We need a resume to assess your experience, a letter of introduction, your why, like why are you seeking this master's degree program and how does it fit in your life and career, and then 3 references. We do not require a GRE. If there are any students that are applying internationally, the graduate school requires some documentation in terms of the transition. But generally speaking, we're looking to see that you have a clear view of how this graduate program would fit in your life career. There's a GPA requirements. We're looking for a 3.0 or higher GPA from your undergraduate degree. If you have a 3.0 or higher and all things else check, you're fine. If you were to have a GPA between 2.5 and 2.99, you may still be admitted to our program, but you would be admitted on a conditional basis. And the conditional basis would be that in your first 9 hours of enrollments, you would need to earn at least a 3.0 or higher, which is to say you would need an A and B in each of your courses on average to transition from conditional to full admission. If you were a student that has a 2.49 GPA or lower, but you have a bachelor's degree, you can apply to the program, and with extraordinary exception of policy, we can petition to the through the dean and of the graduate school and the dean of the School of Public Health for admission. And so we take each case on a case-by-case basis. But again, 3.0 or higher, there are no conditions. 2.5 to 2.99 admission is possible on a conditional basis. 2.49 to 2.0, again, conditional basis, but by exception and with permission and approval from the dean. All right, ladies and gentlemen, this closes the formal part of my presentation, and I'm open to any questions that you may have about the application process, the program in general, or career or post graduate experiences. Right. Brian, Krista, any questions? You can type it in the, if you're at a spot you can't talk, you can type it in. I will also offer this, is that if you think of a question after this session, you can email me directly and I'm happy to follow up. Hey. Well, I'm showing 12:26. Oh, there we go. Yes, 1 second. Okay, Brian.
All right. Hello, hello.
Brian, I can hear you.
Hi. Yes, my name is Brian Anders. Part-time soldier, full-time parental disappointment.
Well,
And um, so, as it stands right now, I'm trying to get into U of L's medical school. But in the meantime, I'd like to keep moving forward and prepare for my future, which is why I'm here looking at your MHA program. If it turns out that I'm able to get into the pre-med post-batch program, would that still allow me to be able to like take one or two of your classes
sir.
while I'm like trying to manage that, or is
Brian, you could do that. Remember that point about you could tap on the gas or the brakes as needed. If you're admitted to our program, and
Mhm.
Brian, please check me on Brian Mathis. If you check me on this, is that my sense is I think the university allows up to 5 or 6 years to complete a master's degree. Look, I'm not sentencing you to a 6 year. I don't want to. What did you say? Constant disappointment.
Yeah.
I doubt that. I bet you're pretty high speed. But the thing is that you have up to that period of time, 6 years to complete the program. Our courses are, thank you, sir, 6 years verification. Um, you could take 0 or 1 or 2 or 3. Each year we cycle through and we offer the courses. We've had a couple of students that are in medical school that take a course or two along the way. We've had a number of, I think we've had about 5 or 6 physicians that either finished out the MSHA as they finished their medical degree, or they were waiting for a post-medical school residency placement. And so it in these transition periods, like pre-med, like I think in the medical school, there's a semester or two that you have strictly for research, which could include working on a master's degree, or if you're awaiting residency placement, that there's also these windows of time that you can positively fill with graduate healthcare management, education development. And so again, you can tap on the gas or the brakes along the way. And I think that, for the 21st century physician executive, matching your medical education, which of course is primary, in terms of being a quality provider with the leadership management development of an MSHA, is a really good place. And even the medical schools are beginning to try, at least in the seminars, to incorporate concepts of like market orientation, understanding health insurance, but matching an MD with an MSHA. I think it's a great place to be. And there's several ways that we can work with you to be able to be dually in two graduate programs at the same time.
Okay. Because I'm not gonna lie to you, I would also say, and one could probably argue that I'm a bit of an overachiever. I have been in contact and talks with your department on combining it with a regular MBA as well to get a more holistic, larger look at like how the economy works, as well as the a larger picture of how the industry works in and out of that. But I don't want to overload my plate, so to speak, but like just being able to manage an MHA while also getting ready to go through that would actually be very ideal.
Anything we can do to help, Brian, happy to help.
Yes, sir. Oh yeah, you've been wonderful. I think that's all my questions that I have for right now.
Thank you, sir.
Yeah, thank you.
Krista, do you have any questions? Well, ladies and gentlemen, I will close out this session. It's 12:30. Krista, I don't know, or anyone that may be viewing this presentation, this information session virtually, unrecorded session. Again, I'm Lee Bewley, lee.bewley@louisville.edu. If you have any questions, please don't hesitate to contact me. We have a really good group of folks that we're looking to put together for our cohort in the fall, and I hope that you will consider joining them. If there's anything that we could do to help, please let us know. In the meantime, happy Easter in advance for this weekend that's coming up, and I hope that you have a great spring and an even better year ahead. All right, take care. Go Cards.